Ovarian cancer will strike more than 22,000 American women this year, and more than 14,000 will die of it.
But now the U.S. Preventive Services Task Force is saying that most women don't need to be screened. CBS 2's Dr. Max Gomez tells us why.
You know, early screening and detection normally means improved survival. But screening tests for ovarian cancer aren't very specific, and that leads to a lot of false positives, which means interventions and surgeries that themselves carry risks. Here's what women need to know. Ellen Stein was a normal, very active, and apparently healthy 75-year-old until she went dress shopping one day.
I was trying on dresses and I couldn't fit into anything. I became extremely bloated, not just a little bit, but I mean as though I were 8 months pregnant.
That was the first sign that Ellen had stage 3 ovarian cancer. Fortunately, she saw her doctor right away for surgery and chemotherapy. But most women aren't as lucky with ovarian cancer.
It has a very high mortality, and that is because that of 75 to 80% of the ovarian cancer is diagnosed in advanced stage, which will be stage 3 or 4.
And even though early detection would improve those odds, the U.S. Preventive Services Task Force today issued a recommendation against routine screening for women without any symptoms. Those symptoms include bloating or swelling, quickly feeling full when eating, unexplained weight loss, pelvic discomfort, changes in bowel habits, and frequent or urgent urination. But those symptoms are vague and pretty common. So how's a woman supposed to know when she should seek further testing?
So there's some progression of the symptoms, and also, most importantly, they're new in nature.
And more intense and persistent.
And more intense and persistent, correct.
The question often asked is, how can more screening be a bad thing? It's about false positives, which ovarian cancer tests have a lot of.
Many women will have surgery or ovaries removed without actually having cancer.
But investigating persistent symptoms like Ellen's can mean the difference between life and death.
I go to church, I go to movies, I go to the library, my husband and I go out to eat, I cook.
Now, again, the no screening recommendation is for normal, healthy women without symptoms. Women at higher risk with a personal or family history of breast or ovarian cancer, or with the BRCA breast cancer gene mutations, they should be screened. And again, if you have any questions about your own personal situation, you don't feel right, then still go to the doctor.
All right, Dr. Max, thank you.